Compare and contrast skin symptom of Silicea and Graphite. Homeopathic Materia Medica third year. Both Silicea and Graphite are deep-acting antisoric constitutional remedy with marked action on the skin. However, the nature of eruption, discharges, modalities, and constitution feature differ significantly. Comparative table for skin symptoms. Feature nature of sign. Silicia, delicate, unhealthy, dry, sensitive skin. Rugged, thick, unhealthy skin. Type of eruption. Suppurative eruption, boil, abscess, pustules. Graphites, moist eruption with sticky discharge. Discharge, thin, offensive pus, thick, honey-like, gloating discharge. Healing tendency. How healing would separate easily. Crack and fissure heal slowly. Main skin affinity. Separation and chronic abscess formation. Eczema and moisture skin disease. Sweat. Profuse offensive sweat, especially on feet. Sticky perspiration less offensive. Itching. Itching worse at night and form warmth. Itching with oozing eruption. Ulcer. Deep fistular ulcer with pus. Moisture. Sticky ulcer with clusters. Skin texture thin, fragile, unhealthy. Thickened hard skin, rugged skin. Crack feature less mark feature behind or nipples, fingers tips. Eczema dry or suppurative eczema, moist eczema with sticky exudation. Gland enlarged gland that suppurates, less glandular suppression. Nail bitter, deformed nail with suppression, thick, rugged, cracked nails. Sensitivity to cold, very chilly symptom, worse from cold, chilly but less sensitive than Silicea. Scar, old scar become painful or open, thick crusty eruption around the scar. Characteristic feature promote eruption of pus and foreign body. Honey like sticky discharge. Important skin symptom of Silicea. Unhealthy skin, very minor injury separates. Recurrent boil and abscess, offensive sweat of feet, chronic fistula and sinus formation. Delicate skin with poor healing. Eruption worse in cold weather. Useful in deep seated suppression. Keynote promote suppression and expel foreign bodies. Important skin symptom of graphite moist eczema with thick sticky discharge, crack behind the ornicle nipples, corner of the mouth, fingertips, rug hard, thickened skin eruption for a crust whose glue like fluid. Skin disease associated with obesity and constipation. Eczema worsen fold of skin. Keynote honey like sticky discharge from eruption. Similarity between the two remedies. Similarities. Both are antisoric constitutional remedy. Both acting deep on chronic diseases. Both have unhealthy skin with slow healing. Both are useful in eczema and chronic eruption. Both patients are generally chilly. Different in class. Silicea, graphite. Suppression, prominent silicia. Graphite, sticky oozing silicia. The offensive pus. Graphite. The honey-like discharge. Silicia. Abscess and fistula. Graphite. Moist eczema and feature. Silicia. Delicate the skin. Graphite. Thick rugged skin. Silicia. Offensive foot swear. Graphite. Crack with crust. Conclusion. Silicia is the mainly indicated in suppression skin condition. Current boil, abscesses, and unhealthy skin with offensive perspiration. Graphite is more suitable for moist eczema, feature skin, and eruption with characteristic sticky, honey-like discharge. These differences are highly important for BHMS Materia Medica Viva University examination.